So thank you, Sarah, for joining me today. Would you like to introduce yourself?
Hi, yes. So I'm Sarah Scobie and I'm Deputy Director of Research at the Nuffield Trust, which is an independent health policy think tank. We aim to improve the quality of health and care in the UK through providing evidence-based research and policy analysis and by informing and generating debate.
Yeah, that's great. And yeah. So we're here today talking about why analysis is important for decision makers in health and care. So would you like to share your thoughts on that kind of topic and anything that you've been doing in this area?
Sure. So as a charity and an independent think tank, we think it's crucial for us to generate impact for what we do. And a major part of how we do this is by ensuring that our analysis is robust and by using evidence to back up our findings and conclusions. And we try and use both qualitative and quantitative analysis where possible. But we do often find that particularly hard-hitting numbers and quantitative evidence can be really powerful for raising the profile of an issue. So, for example, in one of our recent reports on healthcare in prisons, we generated new evidence on the range of health issues that prisoners have and the differences for them in accessing information, in accessing healthcare. And this kind of hard-hitting data can really help to back up information about individual cases. So, for example, there was a baby that died in Bronzefield prison, and that could be seen as a one-off if you didn't know that there were a number of other cases where women had given birth in prison.
Shows that. And how, and particularly around that piece of work, how has it been received and kind of taken forward following that analysis?
Well, so we've worked with a range of stakeholders in the area of prisoners' health, including the Ministry of Justice and other organisations to raise the profile of the issue. And we're just about to start a second follow-up piece of work, which will aim to get a better understanding of what differences it makes to individuals' healthcare from being in prison. So we'll be comparing people in prison with a matched group of people with similar circumstances who didn't go to prison in order to understand more clearly what the impact is on them and the access to healthcare. And so we hope to be able to really get to the bottom of where the prisoners are getting the same access to healthcare, which they should have, and if not, what are some of the challenges? And we'll also be working with stakeholders on identifying policy recommendations to address the issues we find.
Great, that sounds like a fascinating piece of work. Looking forward to seeing where that goes. So my next question is kind of around to the extent that analysis is currently well used by decision makers, and how do you think that could be improved?
So I think certainly analysis and evidence has a key part, but it tends to be alongside a lot of other things. And I think there are some within health and care, there are some structural things that we can do and need to consider about the role of analysts. How their career development is supported, how they can be developed to understand and have a greater role in decision making, and also some of the leadership for analysis. So it would be great if there was a chief analyst role in the NHS, for example. And so I think that there's lots that we could do, but I think a key thing also is providing analysts themselves with the skills to get more involved and to think through questions and understand the implications of what they're analysing, what they're finding. in order that they can be more influential as well and have a stronger voice.
Yeah, definitely. So I'm just picking up on that final point. What do you think that would look like in terms of that skills development and helping them to move into that space?
Yeah. So I think that one of the things that we are trying to do is to make sure that people have a chance to develop a range of research skills. So as well as the technical and analytical skills, also understand the policy context in our case that we're working with, and to think about the kinds of questions that are important to address, and why they're important, and that can then help with things like understanding the underlying assumptions that you're making in your analysis and what the implications are if those assumptions don't turn out to be the right ones, and that then enables you to present findings that can be used in a more practical way, as well. So if this is the case, then we would find this, and if this is the case, then actually we would need to consider, some other factors. So I think there's, I think some of those broader skills are really important, and I guess also communication skills. So having the opportunity to, share your work, present work yourself in meetings and so on. I think those are all really crucial things for researchers and analysts to develop.
Yeah, no, definitely. And sort of also just picking up on your point about leadership and analytical leadership, again, that sort of same question, what do you think that could kind of look like in reality, and what's needed to make it happen?
Yeah. So I think in a number of organisations there is a growing sense that analysts need to be more at the table, making decisions. I think in a lot of cases, the analytical functions, say in the NHS, in my experience where I've worked, have been either sat somewhere in performance or, tucked away under finance somewhere. And I think that thinking about the role of analysts in transformation and in changing health services could provide a route for analysts to have a clearer role. So I think one of the things that's interesting at the moment with the current coronavirus crisis that we're in is that people are making decisions where they don't have history and previous practice to guide them. So many of us who've been involved in planning rounds in the NHS in the past kind of sometimes wonder why we bothered, because you do the planning round and then at the end of the day the finance directors come up with some deal and there we go, models out the window. But I think we're now in an environment where we don't have a model. It's not clear what the how things are going to pan out. Really testing assumptions and working out the implications of those different assumptions is really critical. So I think it's a very difficult time we're all in, but I think actually for analysts there is an opportunity to really show what we can do and contribute to how services are shaped up in the future.
Yeah, definitely. We've definitely sort of seen the raising the profile of analysis, at least in decision making, particularly in the current crisis. Kind of on that note, what main changes do you think have kind of come about due to the current situation, and what do you think what have you observed as being the kind of big things that
mean, it's interesting because I'm slightly in my current role outside of the NHS. But I suppose I think there's a couple of things that are interesting. So one of them is I think there's been a real questioning about some of the information governance and data flow arrangements, and in this situation, decisions have been made to make data available that wouldn't have been possible a few months ago. And I think it's really important that those decisions are scrutinised, not just from the point of view of ensuring that patients' data is treated confidentially, but also for having a better debate about the pros and cons of data sharing and the benefits and so on. So I think that's one area that there's going to be a lot to learn from. I think there's been a huge sharing of information and analysis and so on, which I think has been great, and a greater willingness probably to share between organisations, which is good to see. And I think the other thing that's another positive is the interaction between research and analytical functions. So the research world and the analysis world feel as though they've come together a bit more, which is great too.
Yeah, so yeah, definitely, and that's a really, really positive thing that's come out of this. Particularly in your role, kind of being slightly outside the NHS, kind of how have you? Because I know, so we've been working with you guys at Nuffield Trust, and I know that you've been doing a lot around it, and kind of what would you like to see? I guess kind of what would you like to see change within the NHS, but also within the way that it interacts with you, and what the Nuffield Trust are trying to do.
Well, I think in terms of our role, I think the thing for us is working out where we can add most value, if you like. So one of our purpose, if you like, is to be an independent voice in the NHS, and so, or not specifically actually in the NHS, but to be an independent research organisation. And it's important that we keep that perspective, and that we are asking challenging questions, that we're thinking about the implications of different decisions, and for us it's partly finding the right balance in that, along with making sure that we are sharing what we're doing and contributing to to working collaboratively with other organisations. So I think there's some dimensions there to think about.
Yeah, definitely. So sort of my final question is, in the kind of coming year, kind of what would you like to see as the kind of key change for analysts? So thinking about the Analyst Revolution and kind of empowering analysts to get involved in everything that we've talked about from that perspective, what would you and make better use of analysis in decision making? What would be the kind of key change that you'd like to see over the coming year or 2 or 3?
So I think it would be good to support analysts in the NHS in networking better with each other, and indeed with analysts in local authorities. So over the course of my working career, there's been a big shift, obviously, in terms of public health. And now I think a lot of public health analysts feel very isolated within local authorities. That's not always the case, but I think there's a real opportunity to address that, and within areas working geographically to bring together public health and NHS analysts more closely, because there's some really important transferable skills. And I guess also in terms of particularly some of the coronavirus related work, to ensure that there's a good interchange between local and national work. So there's obviously been a lot of work at national level, and some of that's being translated regionally and locally, but equally local analysts can also feed in and inform some of that work. So I think it's important that there's that two-way development.
Yeah, definitely. Just picking up on I know I said it's the last question, picking up on your networking point, have you seen any examples of where that's worked well, or kind of areas that have networked their analysts in a way that's been productive and positive?
Yeah, I mean, I've in the southwest where I used to work, we had an information network which predated multiple NHS reorganisations, so we basically just carried on meeting as though we were still the old South West Regional Health Authority, and that was quite effective in terms of bringing people together. There's organisations like AFA that are working to develop skills and promote professionalisations. But I think it's also great where there are more sort of impromptu groupings of analysts who work in a certain area. So again, in Bristol, there's quite a strong network that involves both the CCG analysts and some university teams and so on. So I think I don't think there's one way of doing it, basically.
Yeah, that's different.
But yeah, there's lots of different options.
Yeah, no, that's great. Okay, thank you very much.